Hello, everyone. My name is Dr. Brian Thatcher, and I welcome you to this episode of Hope, Healing, and Mercy. And with me today, I have a longtime friend, a fellow physician. Ron Sobecks is a doctor at the Cleveland Clinic. He graduated from Case Western Medical School, did his fellowship in hematology and oncology. That's blood and cancer disorders. He's been at the clinic for over 20 years. He's actually the author of a book, Divine Mercy, Triumph Over Cancer. And this book can be obtained at the Marion's website, Marian, MARIAN.org. And it's a great read for people with cancer and for patients, survivors, and their families and caregivers. The title of this talk really is the quest for the ultimate or definitive healing. And Ron's going to go into some topics here that I think you'll find very interesting. When I was reading more about Ron and read the book some time ago, I was struck by the fact that I became a gastroenterologist, and when I was in internship, didn't really know anything about gastroenterology and didn't know anything about endoscopes and colonoscopes and all these procedures and things, and kind of fell in love with it. And after I got into it, it hit me that my own father had cancer of the colon when I was 6 years old. The doctors didn't think he was going to live. My mom told me, I remember like it was yesterday when I was 6 years old, that they're not sure dad's going to live. And tears are running down her cheeks. And I often wondered if that somehow subconsciously played a role in me becoming a gastroenterologist. So I was quite intrigued when I was reading Ron's book that his grandmother had multiple myeloma, kind of a blood cancer. And do you think that had anything to do with you going into the specialty, or her as a role model? Tell us a little bit about your grandmother.
Sure, yeah, I mean, that's my father's mother, my grandma Marion Sobecks, who was a lovely lady. At the time there, again, I think subconsciously there's no coincidences. So I think the Lord works in mysterious ways. And I've been blessed to be able to work with a lot of patients with blood cancers, including multiple myeloma over the years. So back then I was still a medical student, didn't really know much about the disease at all. And there again, I was just getting married, and my grandmother, shortly thereafter passed from it. There wasn't some of the treatments that we have today. But I do, when you have somebody deeply that you love and you see them suffering, it really touched you. And I think there again, I was discerning the field of oncology, hematology, oncology around that time anyway. But I think that did help solidify some of my aspirations to take off in this field, sort of as you mentioned with your family with the colon cancer and the gastroenterology background.
I loved hematology and oncology, but I remember as a resident, I was spending so many hours and just fell in love with the patients. They were so kind, and most of them, and so thankful and appreciative for every little thing. They knew, and I knew they were in a battle for their, survival. And I found myself getting so close to them. And how does one handle that? As a physician?
Well, I think many of us in the background with faith, it certainly is one way. I think that I find it, we're all suffer for various different ways in life. You don't have to have cancer, but I think we can learn from those who do and who've overcome it or died with it. But I think we're all gonna pass at some point in life, and we all suffer from different things throughout life. But I think they're just tremendous role models. And as you alluded to with the book, I just was encountering one saintly soul after another. And there again, just was an inspiration to me, not to complain about the things I complain about, like writing too many notes sometimes, like including this evening. But anyway, as you see these people just offer up their lives and just they're praying for us constantly. We're all in it together. So I really do have found it ever since I entered the field in a very, very spiritual environment, even for those who don't have faith, I think, or specific faith that they declare. I think a lot of them would share that has been certainly a deep part of the field that really I've been just blessed to be drawn into that area to enter a lot of people's lives that I otherwise would not have had the chance to do if I perhaps took off on some other field.
I'm the youngest of six, and my oldest brother commented to me recently that in the last 18 months or so, we've lost 12 family members. and you realize that, and I kidded him, I said, well, we're on deck, and we're mortal.
Mm-hmm.
We're not meant to last forever. We're meant to love and serve God in this world and be with him in the next. And how there's a more important kind of healing, though, isn't there? We as humans, we think of the physical healing. Lord, heal my cancer. Lord, heal this, heal that. But it's the spiritual healing that is even more important, isn't it? And
Yeah, I would agree with you. I think a lot of people would agree with you. I hope so. But I think as many of us know that so the whole person consists, of course, the physical and the spiritual being. And if the two are intimately related, so if one is perhaps suffering, the other can experience that as well. So if you think about, well, perhaps maybe somebody with a physical ailment, maybe it's a cancer or chest pain or something like that, and whatever that suffering is, the spiritual being sort of accosted by that too, and you have one or two options: either to sort of embrace that suffering, try to carry on as the Lord did, or to kick and scream and run from it and encounter things like despair and things that sadness and fear that just can demoralize or really do injustice to the spiritual being. But on the other hand, if the spiritual being is suffering, sometimes someone may have despair, fear, anger, whatever have you, and it has ramifications for the physical being. Someone that might raise their blood pressure and lead to early cardiovascular disease like heart attacks and strokes. So I think throughout the ages, I mean, the church has seen this. As you read the Catechism of the Catholic Church, actually there are very parallels between a lot of the parts where you read between the physical and spiritual being. So I think healthcare has always been like an extension or a model to that, and it is so it's been just a blessing to have that rich treasure, to appreciate that. And I think that we're all, even people of faith, we're all still learning and having accepted another thing that we may been blessed to have more knowledge about it, but to share that with others and to just keep appreciating the sufferings that we have to encounter in our own lives.
they're interrelated, aren't they? And you talked about fear, and fear is not of God, is it? Because he's a God of inner peace and love, and fear, sometimes for us, I think the fear of the cross is even greater than the cross itself. We get so far ahead of ourselves. I remember the story of the two thieves on either side of Jesus when he died, and we have two thieves in our life: the thief of the past, where we beat ourselves up and I'm no good and I should have done this and would have done this and could have done this. And then there's a group of people who get so far into the future, they're so afraid and anxious all the time, and they miss the beauty of the day. And what I remember with all the cancer patients, that they're over time seems to come a peace and tranquility in them, that they realize they live in the day and thank God for that day.
Mm-hmm.
You make an interesting point in your book that I never thought of it this way. You comment on how sin uh, and is actually a form. It's analogous to a form of cancer. What did you mean by that?
Yeah, I think, well, once again, paralleling the two, as sin, I think is honestly the deadliest cancer and the deadliest disease, period, on the face of the planet, and it plagues everyone. But if we think of a cancer, for instance, if we go to the physical being, someone might have a tumor in the breast or the lung. It starts in one part of the body, and with time, if it's left unchecked, it keeps dividing and spreading and can spread to other parts of the body, and can ultimately, that's how it tends to be fatal. And same thing with sin. It may start in one area of a person's life, might be pride or envy or whatever have you. You pick your poison, and if it's left there to fester and unchecked, untreated, it can spread and advance. And just like in cancer, you start in one area and it's stage one, and it advances, you get to stage 4 widely metastatic disease throughout the person's being. And same thing with sin, is it starts to enter in one area of our life. If we don't attend to it and we ignore it or let it spread, not only can it affect us, it can affect other people as part of the body of Christ. It can affect your family. If there's a big family full of alcoholism or abuse, it doesn't just affect one person. It can affect multiple people or societies and neighborhoods. And so I think those parallels, over time, just gradually gained more appreciation for it, and that's part of what I wrote about in the book. So,
when you were speaking, I was thinking like a pebble hitting the water. It has that ripple effect and it carries out, and it does affect spouses and children, and it's the human mankind, the weakness of
right.
our.
I mean, just like any cancer, if somebody in the family gets diagnosed with lung cancer or multiple myeloma, the people in the family know that their caregiver all of a sudden is maybe not working or able to carry on those responsibilities that normal family life had, and there has to be an adaptation for everyone. So it's a change.
For you and I, we have come to understand and accept that for our beings, the answer is Jesus Christ. He is the great physician. You're not. I used to think I was, but I'm not. And this requires a humility almost of a turning it over and a trust in God.
Mm-hmm.
I had a friend who years ago was telling me the story of her daughter who had a spinal cord defect, and she had prayed so hard and trusted in the Lord so much that the child would be healed, but she wasn't. And that's really not trust, though, is it? It's not that everything's going to be fine and dandy, because in Scripture, Jesus says, pick up your cross and follow me. We will have crosses, we will have sufferings, and it's just part of the walk, isn't it?
Right. Yes, absolutely.
Um, you've seen this COVID epidemic. It seems right now we're in another spike. You've seen, hematology cancer patients are at the higher risk, so you really got to be seeing a lot. It's got to be wearing on you, which gets me into two different topics on the mental effects on the healthcare providers. But tell us, in your book, you had mentioned about a patient, Kathleen.
Well, it's none of the books over, but afterwards with the COVID, it's probably a Kathleen in the book too, but with regards to COVID, I can share. This a beautiful woman, a Catholic woman, her and her husband, they from several hours away from where I work, but they came up for a bone marrow transplant procedure. For those who don't familiar, that's what I sort of do. I work with the blood cancers. And anyways, as she recovered from that and left the hospital, she contracted COVID and got readmitted to the hospital shortly thereafter, and then just really spiraled down and ended up in the intensive care unit on a ventilator. And it was this woman, a really deep faith, to see her have to transition so quickly from with the hope to maybe be cured of her disease, but then to contend with a life-threatening illness. And she ultimately did pass. But during that period of time, she was a woman. Like I said, I was blessed to be able to have the opportunity to get in to see her in the COVID unit. It's sort of isolated, and I think it's been a struggle in some regards, as many know that for Catholics, it's really very paramount importance. And traditionally, people try to get the priest to come in for anointing the sick and sacraments, and that was not possible when people are isolated in these intensive care units. I was lucky to get in there all gowned up as her primary, transplant physician. But I think in that period of time I really felt the Lord blessed me, because I had the opportunity to pray the chaplet of the Divine Mercy at her bedside. As talk about quite a bit. I think many of the listeners are quite familiar with that power of that prayer that the Lord gave us, and to put the Divine Mercy image like you have in your back wall at her bedside, taped on the wall outside. So at the end stages, her husband was able to come and we were able to pray together. But it really was very challenging not to be able to have our typical priest chaplains. They're wonderful. Just that I consider them our spiritual oncologists. They're stamping out these deadly diseases of sin, especially at the end of life when people are, grasping for that healing. And so I think there again, it was a very touching experience for me. And I think during COVID too, one of the things that historically our priests come by and other chaplains and get to bless people's bone marrow transplants as the bone marrow cells are being infused in. A lot of people like to have that done, people from all different faiths. And with COVID, that really wasn't a possibility. And I know at times I was surprised. I got paged a few times by the nurses to have me come up and do it. And I sort of, was blessed to be able to enter in some people's lives, to be able to pray with them. And something that it wasn't necessarily on my radar screen that day, but people really wanted it. So I think those are some beautiful things that despite the tragedy of COVID, that I've been blessed to be able to see the Lord working in our lives.
You know, what you're talking about is a doctor who's got to stay focused on the patient, the symptoms, the treatments, the vitals, and this and that. But we have to remember there's that spiritual side as well. And most doctors don't want to touch that, and nurses and things. And you know, you're so heavily involved with our sister ministry, Healthcare Professionals for Divine Mercy. And I think some of them in some of these states are afraid of losing their jobs if they talk about God. And yet the Joint Commission says you're supposed to have a care plan on spirituality and most people would really appreciate may I pray with you, you know, a gentle way of asking if a prayer would be wanted or needed. What is your experience in that setting?
Yeah, I think over the years, as you alluded to with Healthcare Professionals for Divine Mercy, it really was a invigorating opportunity for me to deepen my faith and my practice, because sometimes I, in the past, perhaps was a little bit more private about it, but and it's always praying for people, but as you're with people and you're seeing them struggle, especially if there's not opportunity for a priest or a chaplain to come by. I've historically liked to ask people, you know, do you have a certain faith that you follow? And then I you know, say I'm praying for everybody, but if you'd like to see a certain chaplain, we can try to make that happen. And that sometimes opens up doors for patients just to start saying they have a certain faith or they don't, or they used to. And you take people where they're at. People take me where I'm at all the time. So I think we're all in it together. And then just grow from that. And in the first visit may not be the long time when you're getting to know someone, but as you work with people in oncology or other disciplines over time, you really develop these, at least a lot of people, very deep relationships, and it's like a family experience. And really, spirituality has been, you know, a lot of people are praying for me constantly, and I feel we're all in together and have the obligation to at least bring that up. And as you alluded to, the Joint Commission, it's a pretty clear standard out there to at least try to address the spiritual assessment of patients to try to meet those needs. And they're not specific. Each hospital has leeway how they want to achieve that, but they have to address it. And so I think that's an opportunity to not be shy to bring it up. And if someone really is busy or doesn't have a lot of time, just to reiterate that, yes, we have chaplains that we would, you know, be more than happy to have come up and see you. It's been tricky with COVID, of course, but still possible now.
Looking back, or we're in the middle of this again, the spike and things, but you have any thoughts on how the church could better assist the patients, not just in the hospital, but also in the nursing homes?
Yeah.
You know, and then let's talk about all the implications when they can't see their spouses and their children. And, you know, what are your thoughts on all that?
Yeah, I think it can be very demoralizing. I have an older friend right now who's been locked down for 7-8 months in her nursing facility, and her daughter can't get in. She got out for a few times for doctor appointments, but I think a lot of it, just the fact that the loss of some of the personal contact and outside world, it's just like a solitary confinement, almost like in prison for some people. And if you're not feeling well on top of it, really can be quite detrimental, to say the least. And so I think we're blessed though, compared to old days when people didn't have phones or ways to communicate or Skype and things like that. If you think back in the Spanish flu in the early 1900s, the three little children of Fatima, the two of them who died, they didn't have an opportunity to see mass on TV every day or to talk to people. And it was complete isolation. So it is very, very hard, but I guess it's relative to compare what people have done throughout the ages. But I completely agree with you that I know that obviously the Mother Church is praying for everybody. There's no barriers or walls and stuff like that between her prayers and graces and the masses. But there is that sacramental presence of the presence of touch and just being in you know, when you receive reconciliation. It's not something you typically do over the telephone. So having some of those barriers right now has been a challenge. And one of the things that not just our diocese, but some other dioceses throughout the country have been trying to address, they've come up with some protocols for priests to potentially go into the COVID units with following strict, protective precautions and things like that. And I know that's something we're working on in the Cleveland diocese, just try to see how we can help potentially implement or make that more of a reality for these patients who are, really critical with COVID. And with the hope too, of course, people in the nursing facilities, hopefully there'll be an opportunity for them at some point as well.
Now let's get back to the healthcare professionals themselves,
Yeah.
because this is a heavy stress on them as well. My daughter-in-law's sister, who works in an intensive care unit hospital here in Tampa, just got diagnosed with COVID. And then you get into the quarantine, you get in the kids tested, the husband tested, and all the fingers that reach out and the ramifications and everything. And it's very stressful. And I can only imagine what it'd be like to go into that every day. It's like you're in a MASH unit, I would think. Share some thoughts on that, Ron.
Yeah, well, I'll preface it by saying I'm not the one working in general in the COVID units, but we have people come and go. But I think it is something that even people of the most passionate for their work, there's a thing called sometimes compassion fatigue at times. I think in the psychology literature, where you're pouring your heart and soul out, and and you come home, you have to try to take care of your family too, and worried about your own health. So this really had been a major insult from all angles to healthcare providers. I think before COVID hit it, there was lots of stress and burnout in the healthcare field before that, and this just accentuated or really added to it. So I sympathize for a lot of some of my colleagues that are living in intensive care units and have had to be isolated from their families, or if they contracted it, of course. So it is a challenge. I think there again, it's still a moving target. So I don't know if I have all the answers, but I think obviously for those of faith, the spiritual riches and treasures obviously can get us through anything. And I think we're sort of obligated to help pray for our other colleagues who may not have that, or at least to show compassion and mercy and love, some of the virtues that, the corporal works of mercy. That's a tremendous opportunity for us, not just to take care of ourselves and our patients, but our coworkers as well. Because we're all, as people have said, we're all going to be a patient at one point or other. So, and some people get thrown into that just from overworking or burnout at work,
Here in Tampa, we have MacDill Air Force Base. And so there's a lot of military, and I've met so many military, ex-military people who have suffered some degree or element of post-traumatic stress syndrome. And I almost look on this COVID as something like that. You're just, it's just a stressful situation. And, how does one handle this burnout? What would your advice be to or fellow healthcare workers?
Well, I think the first thing is try to recognize it. I think a lot of people in healthcare, they come in we all, I think, are sort of called to that feeling. They sometimes feel like a vigilante going in there to really help mankind or womankind. And it's sometimes we have to remind ourselves to eat and sleep and take care of ourselves, and not only physical being, but our spiritual being. I think that's a big importance. But once we sort of recognize, there's sort of a spectrum. People can have stress. That doesn't necessarily mean they're burned out. But if you look at some of the literature broadly throughout the healthcare, at least in the United States, there's at least 40% of people in multiple disciplines, not only senior physicians or of all age groups, trainees, that are experiencing burnout. And the classic triad for that is this emotional exhaustion, depersonalization, and then this loss of any personal achievement or accomplishment. And with those three, those are the classic signs that this person's experiencing burnout. And they can become very cynical at their work, with their family life. It's astounding suicide rates. If you look at some of these things, dealing with this, it's very a huge problem that sort of goes beyond the radar screen. A lot of people just go to my healthcare professional and everything be hunky dory, but they don't always necessarily know what's going on in these people's life. And we're all human, and we need their prayers and support as well. So it's a challenge.
And then there's the issues also of addictions.
All right.
That are in the general population. Just addictions, as you know, shows no correlation or disparity with level of education. That has nothing to do with it. And so it's just a real tough time. I want to get back to this definitive healing, though, because I think the point that has hit me over the years as I get older, I think of Our Lady of Lourdes, and people would go to Lourdes for the healing waters, and some of them would be healed medically, but probably even more, I suspect, would get that spiritual healing that they need to enter into the next phase
Right.
of existence, and really isn't that what this is all about?
I'd agree. I think that's the, um, as you know, as you I think alluded to earlier, we're just passing through this life. Even if you're lived there 80 or 90 or 100, it's a blip in the curve compared to eternity. And so, as we're nurturing our spiritual being, this is the time really to try to foster it. And I think some of the challenges in life, just like with anything, when you work real hard at school or practice football, whatever that daily grind, going over and practicing over and over with the sufferings and the pain, and no pain, no gain, of course. But those are opportunities for us to keep refining ourselves and helping others along the way, just like others have helped us. And to take advantages of those sufferings. I think you've alluded to other people, Father Chris, have noted in St. Faustina's diary, she said, if the angels could be jealous of humans for, if they could be, there'll be two things they'd be envious of. One is to receive Holy Communion. So we have that intimate bond with our Lord, and then suffering, because it's such a tremendous gift, and it's not easy for anybody, of course, but it's an opportunity to share in the Lord's redemptive work of salvation throughout time and history. And St. John Paul II had a brilliant apostolic letter. I noted a little bit in the book as well with Salvifici Dolores. He wrote it in 1984, but just reminding us that with each of us, our suffering, if we really embrace it with the Lord, it's like having a particle in the Lord's suffering, which has infinite value in terms of the redemption of the world. So I think, I don't know that everybody looks at it that way. I know as a younger guy, it wasn't even on my radar screen, but as I read his works and just witnessed patient after patient doing this, and some people are just filled with joy despite some of the hardest sufferings. And I'm complaining about doing a few notes extra in the evening, so it's all relative, but just to use those opportunities and the graces that come from them to help not only ourselves, but the world and, throughout time and history.
Suffering is so difficult. I remember reading in Mother Teresa's, one of her books, a story. She was comforting an elderly patient in Australia who had bone cancer and metastases in the bones. It was very painful. And Mother Teresa's caressing her hair and saying, "Oh, just think every time you have that severe pain that Jesus is kissing you." And this lady shot back, "Well, tell him to stop kissing me," and so it is difficult. And that, like I said, we live in a valley of tears. We will have our crosses, and we just got to trust in the Lord. And that's like below the image, Jesus, I trust in you. And that's got to be what keeps us going.
Yeah.
Uh, but as a physician, you have so many examples in your book of people who have it. You look at it from a worldly sense and say, man, they got hammered. They got this disease and had multiple this and that, and yet they have a smile on their face. I mean, that's got to be inspirational to you, I would think.
Absolutely. I mean, I think keeps you humble. I mean, and sometimes to remind ourselves, anything we do good, of course, is from the Lord, and anything that we don't do so well is from our own being. But we have these. It's like looking in a mirror. I really do think sometimes we can learn from anyone. Instead of saying, "Oh, what did that person do bad?" This what just the Lord gives that example, I think, to us. So what do I need to learn from this? What do I do that I might not exactly do the same problem or sin, but I'm sure there's something in there that I can learn from this, that practice or that behavior or whatever, that talking too much, whatever it is, it's an opportunity, and the Lord puts, I think, these people in our life, or others, or family, or friends, or patients, and vice versa. Just to remind us, look at, like looking in a mirror. What can you learn from this? And he keeps giving us countless opportunities to keep refining ourselves. So I think with all those patients that I wrote about, this is just like, for me, just a wonderful, those are my professors in life, not some older guy standing behind a lecture hall, because we're all going to pass at some point in life. We're going to have difficulties in our families or friends, but how do we embrace it and or make better of it and help bring that definitive healing that we're all longing for, that peace in the soul that you were alluding to?
I have to say, Ron, I don't really have regrets, not the right word, because if I hadn't made all my mistakes, I wouldn't be where I am now. But I remember alcoholics, undocumented illegals coming in and bleeding to death in my arms, and I'm trying to do endoscopy and sclerotherapy and all these treatments, and I was so distraught then, and so I just went home and just but I didn't really realize or think about this person just passed into judgment with the Lord, and I didn't say a prayer, and you you're aware of that, and that's a real blessing, because there's so many promises of praying for the dying. As Catholics, we believe in the communion of saints, and it's more than just a job, isn't it?
Yeah, no, it's truly a vocation, and you don't have to be a formal healthcare provider. I think people care for their kids, their parents, their friends. Everyone, not everyone, but I think most people in life at some point touch upon a caregiver role. Just driving somebody to school who's sick, what various, or to the doctor who's sick, just things like that. But how do we kick and scream? I really don't want to do this today, or do we just say, yeah, I'll offer this up? I'm thankful for my health, but this person, So I think, once again, there are people like you said, St. Teresa of Calcutta was a premier role model in our day and age. There's just all these wonderful examples around us, and just hope we can learn. And that's how we're going to light up the world and change things for the better. It's like one split at a time. We work on our own, of course, but try to bring people along and let them help guide us, to have the humility to say, I don't know it all. I mean, if you're a cradle Catholic for all your life, we all have plenty to learn. And some of the little children, 3-4 years old, teach us profound insights that that we would not going to learn from a lot of adults.
Even these works of mercy, I remember years ago I heard a comment, don't count the cost.
Mm-hmm.
And what does that mean? Well, don't do things expecting something in return. And we say, as Eucharistic apostles, mercy is love that seeks to lessen the misery of others. And we don't expect, you don't invite somebody over for dinner expecting a return invite. It's just do things out of love of God. And even in the works of mercy, the Lord, he didn't ask Faustina, he demanded, I demand from you deeds of mercy, but they to arise out of love of God. And not only physicians, though, like you said, all of us are in positions every day where we can reach out to others.
Mm-hmm.
And I think when we reach out, our peripheral vision spiritually becomes wider and wider and wider. And I remember years ago, again, Mother Teresa, she was in a building in Calcutta and told her driver to drive around the other side of the building. She couldn't see through the building. She tells him there's a man dying on the other side. So he drives her around, man's near death. She puts his head in her arms and said, God loves you. And he died. And it was that tremendous spiritual peripheral vision. And that's what I think we all need to work on, but it's through getting out of ourselves,
Yeah.
got to step out. And that's, I think, what the healthcare people are really doing these days with the COVID, though. And
I hope so, yeah. And
yeah.
I think as you alluded to, when you do that, you stop thinking about yourself or your own aches and pains. As people say, how do these people do some of these things? They're starved, they're not taking care of themselves, but they're burning with love for other people. And it's very very gratifying to see that kind of, not everybody's going to see it, and most people don't see it. That's why I said there's so many unknown saints in the world, or do at least saintly acts, and they're just all around us if we look. And hopefully, you and I can try to follow their example too.
Years ago, I heard at a conference, a priest was giving a talk about the Passion of Christ, and he was comparing it to his own suffering, which was a talk on his ingrown toenail surgery.
Okay.
And that's how, some of us, we think we've got the biggest cross in the world, and you're seeing the ones who really have crosses and are an inspiration and full of love. And it's like the image behind me, the rays of love are emanating out. And I just think as healthcare professionals, as more and more learn and understand that it's okay to talk religion, it's okay to talk about God or spirituality, and continue to show love and compassion, that, when people look in your eyes, they'll see the face of Jesus himself.
Yeah.
And that's, I'm sure, what your goal is every day when you deal with these dying people.
I heard a priest from the Cleveland Diocese a number of years ago, and I always thought it was a really brilliant thing. It was like, really, you may be the only pages of the gospel someone will ever read. And it's very true that some people, again, the Lord puts you in that life, like it doesn't have to be COVID, but, wherever you are, it could be in a supermarket, wherever, somebody who's despair, thinking about suicide, somebody comes by and just starts talking to them, gives them the moment of the day, whatever it is, so to try to live those, you may not be reading the Bible out loud to them or the gospel pages, but the way you're showing and living the life of Christ or trying to do that, they can have profound impact on people. And I really do think it's a blessing.
Well, Ron, I want to thank you for joining us, and I admire your work there, and I know your love for the patients. And we know we have to be the heart and the feet and the hands of Jesus Christ to a hurting world, and many people don't know Jesus Christ, and this is how they will, by looking at us, and because you have love in your heart, and healthcare professionals are in a unique position because they're dealing with dying people.
Yeah.
And the Lord even said, the dying have the most need of trust, and they often have it the least. So, and you've always looked on your job is not a job, it's a vocation, and that's a special gift from God. So thank you for joining us, and all the viewers, thank you for joining us with Dr. Ron Sobecks and the talk on the quest for definitive healing, as we thank Ron for joining us tonight and sharing with us these wonderful insights. And again, I'd encourage you to get his book, Divine Mercy, Triumph Over Cancer, available at Marian, MARIAN.org. And may God bless each and every one of you. Thank you again.